They started arriving at 7 a.m, driven every single one of them by pain and decay. A queue in 21st century Britain in Bury St Edmunds for a charity providing emergency dental care.
It's like a shooting pain, sort of at the top of my teeth.
I yanked out one of my back teeth because I was in so much pain. It was loose, so I just wiggled it and used numbing solution that you can get over the counter from the pharmacy, numbed the area and then wriggled it and pulled it out myself.
Ow! Did that hurt?
It was one of the back teeth. Yeah, it hurt, but I was in so much pain I had no other choice.
I definitely need fillings. I've had quite a lot of pain in my teeth for a while now. And Ruby's got pain in her back teeth because she hasn't got any enamel on them.
Dentaid has been to this part of Suffolk 4 times now. Normally they provide treatments abroad or in the UK to homeless and vulnerable. But they're here today because not one person in this queue could get a dental appointment.
We're catching things so much more later on. People have changed their habits in terms of eating and looking after themselves. They haven't been going for their routine checkups. They haven't been able to get face-to-face appointments with their dentist or doctor. And so when things become a problem, it's much harder to treat, and then you're catching it much further downstream.
6 volunteers, dental nurses and dentists are here today, but by 10:30 a.m, they'd started warning those still turning up that they may not be seen. This is actually quite shocking. There are so many people here now that Dentaid won't possibly be able to see them all. But this isn't just happening in Bury St Edmunds, it's not happening just in Suffolk, it is across the nation. There are not enough dentists left in the National Health Service. This woman didn't want to be identified, but she showed us the teeth she had pulled out herself.
I phoned dentists, couldn't get anywhere.
And are you in pain now?
Yes, this tooth up the top here. I've only actually got about 5 teeth left at the top, so I've got a plate for the others. No good
And
now.
what's the pain like?
Oh, it's aching.
Good morning.
Giving evidence to the Health and Social Care Select Committee this morning, the British Dental Association said the situation is now unsustainable.
In NHS dentistry particularly, we are facing a crisis, the likes of which I haven't seen in my 35 years in the profession. And NHS dentists are genuinely struggling to see the light at the end of the tunnel.
Dating back, he said, to the 2006 NHS contract.
The top and tail of it is that a dentist will be paid the same for 10 fillings as they would for 1 filling. They will be paid the same for 3 extractions as they would for 1 extraction.
The British Dental Association estimates that at least 3,000 dentists in England have stopped providing NHS services since the start of the pandemic, while 3/4 plan to reduce or further reduce their NHS commitments within the next year, and nearly half say they plan to leave their jobs altogether. COVID has only made the problem worse, and this Ipswich practice saw how desperate it has become.
At this site, we were an emergency centre while everywhere else was closed, and we saw vast numbers of patients who had unmet need, treatment that just hadn't been carried out because they are struggling to find a dentist who's willing to do the treatment, and you're just basically fighting fires all the time with just sort of patching them up, sorting out the emergency, but never actually getting the patient to a state of health.
Our practice team is under extreme pressure at the moment.
Back in Bury, we meet Pippa Phipps, introduced through the local campaign group Toothless in Suffolk. She's been trying for months to get an NHS appointment.
We understand that it is a challenging time.
Last year, a cracked tooth became so infected she was taken by ambulance to hospital, where she spent 2 days on a drip having the infection drained.
If I'd had an NHS dentist in the first place, maybe it wouldn't have got to the point of that. It wouldn't have been that bad. But every time I'd phone a dentist, it's first thing in the morning, but no, all our emergency NHS appointments are gone. And there's just nothing out there from anyone.
The following day, Pippa is in the Dentaid chair. Another tooth had cracked.
When did that happen? It happened a couple of months ago. Okay. It's been getting progressively worse. I did have a put the filling in it.
Yeah.
They did say they could do root canal or take it out.
Okay.
I would prefer it just be taken out.
You want it taken out? Yeah.
So out it comes, quick and apparently painless.
So what happened?
I just had my tooth taken out.
And how are you feeling?
I'm feeling fine.
Are you?
Yeah.
Are you pleased? Are you pleased to have had it done?
I'm very pleased. I'm glad I'm not going to be in any pain anymore.
Dentaid was given some money by local town councillors to come here. They took it from budgets normally used for local projects. But this is patching up. There is little more that the charity can do before they have to move on to the next town.